Hello everyone, and thank you for joining us in today's webinar on being a support buddy. My name is Sushmita Singh, and I'm a psychologist at Manotsav Foundation. We are an NGO working in the area of child and adolescent mental health. On behalf of Manotsav Foundation, I would like to welcome you all. With today's webinar, we want to reach out to the people around us and help them support each other in better ways. Now, without further ado, I would like to introduce today's speaker, Ms. Palasha Parikh, my colleague and research psychologist at She has done masters in psychology from Boston University and has experience of working as a youth and family therapist. I would also like to welcome chair for today's session, Dr. Shilpa Agarwal, child and adolescent psychiatrist and managing trustee at Manotsav. She is an internationally recognized clinical scientist in the field and has extensively worked in the area of self-harm in youth.
So a lot of these things are signs and indicators, but obviously you don't want to just pick one thing in isolation and say, ki, oh, ye ho raha hai, so she must have a problem. It's not that. It's you want to understand that in terms of the context of the person, in terms of the lifestyle of the person, and how relevant it is to the person. And it's easier to do if you know the person really well. If you know if it's a family member or if it's a friend or if it's an acquaintance that you know about or you talk to. A huge sign is actually not participating or enjoying in activities that they generally like. So say for example, they really liked, going out or maybe dancing or maybe singing, and suddenly they've stopped doing all those things, or even participating them or, enjoying what they do. And not always, obviously, sometimes we do have change in interest, but, interests that are long-term or long-term hobbies don't suddenly stop or, change. So you might want to just check in, you just stopped doing this, what happened? How are you doing? That's usually a good also way to start a conversation. Then a drastic change in lifestyle. This this you would notice over a period of time, usually, and it happens often unless it's more of a conscious, choosing a healthy lifestyle. That would be very different. But this is more like in the terms of changes in weight, sleep, appearance, and all of that, but over a period of time, and the way their lifestyle is, and if the person says. Now, this sounds very obvious, but I think a lot of times we tend to overlook when people just come and directly tell us, I've been feeling sad like this whole month or this whole week, or I feel like I just get angry anytime over anything, and I don't know what to do about it, and it's really bothering me. So a lot of times when people are experiencing distress, they do understand that. They do realize that. Ki kuch to alag hai. I wasn't like this before. So if they are coming and telling you, they are probably aware about these changes, and it might be helpful to pay attention to it. Now, how do we go about helping someone who's experiencing distress? Let's say you've identified that, and you go and approach them, or they come to you to talk about it. So first we can talk about how do you go and approach them. Most experts, most people in the field will tell you that the best thing is to just start a conversation. You don't have to fix a problem. You don't have to have solutions. You don't have to, have a lot of training or knowledge. You just have to ask, just politely ask, um, how are you doing? Or you seem a bit different lately. What is happening for you? Or I've seen you, you were really worried. Are you okay? Do you want to talk about it? Or let's say you've seemed a bit distant or stressed lately. If you want to share, I'll be happy to listen. So these are just ways you can approach the person. Of course, sometimes it's important to keep in mind if they may or may not be open to you approaching them, what relationship you share with them can also make a difference in how they may be open to responding to it or talking about it. So um, but if you do feel a concern, just tell them. And I think being genuine just helps a lot. One of the most important skills is listening, and it can be used universally at any time, any place, with anyone. And I'm going to point out why this is such an important. So when we're doing this simple action of listening, we are addressing many emotions and thoughts with the person that we're listening to. So let's just say that you're listening. Now the person feels like they're seen, they're heard. There's someone that wants to understand them, understand their point of view, their perspective on what's happening, and they feel valued. And this is very important, because for a lot of people who are struggling, who are distressed, they often feel, I don't know if someone's going to understand me, or maybe they don't think this is important enough to talk about. They'll think they'll think it's such a small thing, why should I talk about this? So but when they are hurt too, they feel like what I have to say is important, and this person is taking out the time and attention to listen to me, so they do care for me. And it's a way of reassuring the person also that you're not alone, and I'm here for you. So you see, one simple action can actually address a lot of things with a person, and over time, this can be of tremendous help. And of course, eventually, if you think that that the person might need more help, you want to encourage them to seek a professional. In fact, in most cases, it's always best to seek a professional advice. So you supporting them or showing them support or being with them, being there for them, also encourages them and or gives them the courage in a way, that to seek out professional help or to reach out to someone, to find someone, and maybe talk to them and not feel alone in the whole process of doing that. It becomes less scary when you have someone doing that with you. So that can be very helpful in itself.